Good morning, everyone. I'm Riley King, and welcome to this morning news report right here on the Riley King Network. Let's begin. First doses of COVID-19 vaccine arrive in New Hampshire, earmarked for long-term care, high-risk hospital workers. Vaccine expected to be administered to those at high risk starting today. The first doses of the COVID-19 vaccine arrived Monday in New Hampshire. The shipment from Pfizer was being unloaded and processed. State health officials said they plan to begin distributing the vaccine to at-risk healthcare workers involved in direct care of patients with coronavirus in hospitals and long-term care facilities. The first doses are expected to be administered within 24 hours. New Hampshire has had more than 9,900 COVID-19 cases in December alone, representing about 32% of all cases over the course of the pandemic. Getting the vaccine is not mandated, and there is no system in New Hampshire to track who has received it. Governor Chris Sununu said the arrival of the first batch of the vaccine is the start of the end of the crisis, but he said it will still be months before life starts going back to normal. Today is a day that I think a lot of us have been waiting for quite some time. And if you had asked me 4 or 5 months ago if a vaccine was going to be here before January 1st, I would have thought you were crazy. But let me tell you, they got it done, he said. Sununu said the vaccines are being distributed statewide on a proportional basis to hospitals, Walgreens, and CVS Pharmacy. We have a system now that keeps track of what the need is, Sununu said. So everyone lets us know what they need, and depending on how much we get from the federal government, we just distribute out a pro-rate share to each of those facilities this week, and then another shipment will come out next week. Phase 1A of the state's COVID-19 vaccination program is aimed at the highest risk population for both acquiring the virus and dying from it. Of the 12,675 doses now in the state, 7,800 are set aside in order to activate the federal long-term care facility program that starts next Monday. The rest are set to go to hospitals this week. Those hospitals can start ordering vaccine today and will provide it to them when they're ready to receive it, and they have clinics scheduled, said Dr. Beth Daly, Chief of Bureau of Infectious Disease Control. All 100,000 people in Phase 1A are expected to be vaccinated by mid-January. Phase 1B is in planning now and is geared for adults living in congregated settings, such as senior housing, and for high-risk individuals. And that does it for this morning news report right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another news report. Goodbye, everyone.